Hello, my name is Sarah Welty. I'm going to talk to you a little bit about Huntington's disease and the care for patient and family. Huntington's disease is a neurological disorder. It often goes misdiagnosed as its symptoms manifest like other symptoms in other neurological disorders. However, Huntington's is unique in the sense that it's got a completely genetic link. If a parent has Huntington's disease, the odds of them passing on to their child are 50%. Additionally, diagnosis with Huntington's happens between the ages of 40 and 55. It is terminal, and average life expectancy post-diagnosis is anywhere from 10 to 15 years. Huntington's not only affects cognitive and motor skills, but can also manifest in psychosocial situations, and some patients may actually end up developing episodes of psychosis or schizophrenia. Huntington's is difficult to care for because it is such a unique disease and it is truly tailored to each individual. In addition to making sure that the patient is being cared for and is safe at home and is able to make decisions about their health care, we as nurses need to make sure that we are involving the families as much, because family caregivers often step into this role with patients with Huntington's disease. There was actually a survey done in 2010 where caregivers were asked about their specific quality of life and living and caring for someone with Huntington's disease, and those caregivers said that their biggest concerns were that they didn't have access to community resources and social services, that they had financial concerns because perhaps the breadwinner was that person who was diagnosed and is no longer able to work. They had concerns about safety because of the personality changes and some of the psychosocial changes that occur. And they had concerns about the professionals who were handling the person that they loved and making sure that those professionals had a full grasp of Huntington's disease, the disease process, and the importance for a multidisciplinary team to care for that patient. So what we do as nurses in our practice, we need to make sure that we are listening and we are taking care of not only the patient but the family as well. It's very important that the patient's able to vocalize to us what their concerns are, able to be involved in pain management, able to be involved in prophylactic management of symptoms since there is no cure. But it's also really important that we are making sure that family has access to the resources that they need and that we're putting together a strong multidisciplinary team to take care of this patient and the families. And that may look like including physical therapy, occupational therapy, speech therapy, physicians, social services, and community resources. I've included a graph. So Huntington's disease, as I mentioned, occurs typically between 40 and 55. There may be an earlier diagnosis. A diagnosis before age 20 is called juvenile Huntington's disease. The outcome is exactly the same. There are also clinical stages of Huntington's disease that are relatively typical. Again, you may see different manifestations in each individual patient, but the big three are going to be changes in cognitive function, motor function, and psychosocial function. As an RN, it's really important that we are there for not only the patient, but we're there for the family, and we're really stepping it up and making sure that we're listening. We're making sure that we have access to the newest and the best resources. We're making sure that we're giving the correct referrals, and we're making sure that we're taking care of the family as a whole. It's very easy to want to just take care of the patient, but one of the things that we can do is start having discussions about end-of-life care and palliative care with the individual and the family once that diagnosis comes across the table, so that the family, for instance, doesn't have to make end-of-life decisions for this patient that hadn't previously been discussed. In conclusion, as an RN, be prepared to help the patient by managing the symptoms across the spectrum, but also as an RN, be prepared to offer support and assistance to the family. That's going to be a huge piece, and making sure that the caregivers are getting all of the help and support that they need, whether those concerns are safety, financial, or medical. We have to be the lead in making sure we're staying up on education and up on research, and making sure that our patients and their families have access to those things as well. So that in a nutshell is Huntington's disease. Very nasty disease, and very, very much a whole family affecting disease.